Assalamu alaikum. So in this lecture we will discuss about a medical condition known as cholelithiasis. Cholelithiasis is the formation of stones in the gallbladder. So what is cholelithiasis? Cholelithiasis is the stone formation in the gallbladder. In this lecture we will discuss about the causes, the most important complications, treatment and investigation of cholelithiasis. So what is cholelithiasis? Cholelithiasis is the stones in gallbladder. What are the causes of cholelithiasis? To remember the causes, you should remember the formula of 4F. Means a 40-year-old fatty multiparous or fertile female presents with the right upper quadrant pain indicates it should be a cholelithiasis. So other causes of cholelithiasis are infections and weight loss. Rapid weight loss can also cause cholelithiasis, and hemolytic conditions, hemolysis or hemolytic conditions like most commonly sickle cell disease or thalassemia. So cholelithiasis is commonly found in patients having any hemolytical conditions like sickle cell disease, which is also in thalassemia. Both are chronic conditions. So you may suspect if these patients present with right upper quadrant pain. Other indications of cholelithiasis are a 40-year age, commonly found in females, fertile and fatty. Obese patients have more prone to the cholelithiasis. What are the symptoms of cholelithiasis? Usually cholelithiasis is asymptomatic. But it presents with colics or can say abdominal pain when taking fatty meal. We should remember, if a patient says he or she is taking fatty meal and will feel colics or abdominal pain, it may indicate is the cholelithiasis. Why when taking fatty meal it cause colics? Because when we take fatty meal, the pain in our duodenum, enzyme is released known as CCK. Our duodenum releases enzyme known as CCK enzyme, which cause gallbladder motility. Which cause colics. Simple. But this cholelithiasis, if these stones move to migrate to other areas like the biliary duct or pancreatic duct, or in some cases if the gallstone is very large, it can perforate and enters the intestine. It may cause some severe complications. What are the complications of cholelithiasis? If enters biliary duct, it will cause conjugate bilirubin anemia or can say jaundice. Patient complains of severe pruritus indicates bile in the blood, increase high level of bile in the blood. Or if enters the pancreatic duct, it will cause severe abdominal pain. It cause pancreatitis, severe abdominal pain. Untreated cholelithiasis can cause pancreatitis or can cause bilirubinemia. But in some cases, if stone is not migratory, it can cause gangrene of gallbladder, or in some cases in large gallstones, it can cause perforation to intestine and block the intestine. This condition is known as gallbladder ileus. Or in some cases, it can cause carcinoma. It can also cause cancer. So it is very important to treat the patient of cholelithiasis. Now discuss about the investigation. Investigation of choice is ultrasonography. Ultrasonography is the ultrasound abdomen is the investigation of choice of cholelithiasis. And what is the treatment of cholelithiasis? The treatment of choice of cholelithiasis is cholecystectomy. Remove the gallbladder. The complication of cholecystectomy, if the gallbladder stones are removed by ERCP, there will be recurrent cholecystectomy. So in this condition, we will usually remove the gallbladder. And what are the indications of cholecystectomy? Because if this condition is asymptomatic, there is no need to do cholecystectomy. And what are the indications of cholecystectomy? Because we can't operate every patient presented with the colic pain. So what are the complications? If patient is diabetic, only indication you should remember is diabetic. If patient is diabetic, is symptomatic or not, you should do cholecystectomy. Other is hemolytic conditions. Or during any abdominal surgery. In any abdominal surgery, you can remove the gallbladder to avoid cholecystectomy. And another complication of cholecystectomy is infection or swelling of inflammation of biliary duct. This is the biliary duct obstruction. It can cause the infection of the biliary duct or can cause the blockage of biliary duct.